Hi guys, in order to bring new dimension to our life, we need to change few practices, and those daily practices come from our change of thoughts. So, charity begins at home, as the new popular poet has been telling, we can say. But what I think is that charity begins in your mind, and the change starts from you and it ends to you. So, with that, let's start with today's new topic, which is Epistaxis from the nose section of Otorhinolaryngology, that is ENT subject. So basically, what is epistaxis? Epistaxis is a term which is said for nose. From nose, inside the nose, whenever there is bleeding, that is said to be epistaxis. And this bleeding is fairly common. In which age groups? In children's, in adults, and in older people. We have three of them. And it presents as an emergency condition. It needs to be treated as an emergency condition. And epistaxis is a sign and not a disease as per se. But it can be an attempt should be always made to find in local or constitutional courts. Blood supply of nose. Nose is very richly supplied by both external and internal carotid systems, both on the septum as well as lateral walls. So, on nasal septum, internal carotid system consists of anterior ethmoidal, posterior ethmoidal, and branches of ophthalmic artery. Three of them. An external carotid system consists of sphenopalatine artery, which is a branch of maxillary artery, which gives the nasopalatine and posterior medial nasal branches. Next is basically the septal branch of greater palatine artery, which is a branch of maxillary artery, and septal branch of the superior labial artery, which is a branch of facial artery. So these three, sphenopalatine, the septal branch of greater palatine, and septal branch of superior labial, basically these three will form the external carotid system. And lateral wall. Lateral wall is basically these are the structures supply the nasal septum. Okay, so internal carotid system and external carotid system. Then lateral wall is supplied by again internal carotid, external carotid. In internal carotid we have anterior ethmoidal, posterior ethmoidal, and the branches of ophthalmic artery, like the same internal carotid system which was supplying the nasal septum. But here there's a twist. External carotid system is different because here posterolateral nasal branches from sphenopalatine artery, not the entire sphenopalatine artery, but its posterolateral branches. Then greater palatine artery, not the septal branch of greater palatine artery. Like see, sphenopalatine artery itself supplies the external carotid system of the nasal septum, but sphenopalatine artery ka branch posterior lateral supplies the lateral septum, lateral part of the nose, and greater palatine artery itself supplies from the external carotid system to the lateral wall, but here septal branch of greater palatine artery supplies. So there's a difference between the two. Next is basically nasal branch of the anterior superior dental from the infraorbital branch of the maxillary artery, and branches of facial artery to the nasal vestibule. So these basically form the external carotid system supplying the lateral wall. Next is Little's area. What is Little's area? Little's area is situated in the anterior-inferior part of nasal septum, just above the vestibule, and there are four arteries: anterior ethmoidal, septal branch of superior labial, septal branch of sphenopalatine, and the greater palatine. Four of them, and they anastomose together: sphenopalatine, greater palatine, septal branch of superior labial, and and this anterior ethmoidal. All of the four anastomose to form a plexus, which is called Kieselbeck's plexus. And this area is exposed to drying effect of the inspiratory current to fingernail trauma, and is usual site for epistaxis in children and young adults. Next is retrocolumellar vein. This vein runs vertically down outwards but behind the columella and crosses the floor of the nose and joins the venous plexus on the lateral nasal wall. Common site of venous bleeding in young people. So, Woodruff's plexus is a plexus of vein situated inferiorly to the posterior end of inferior turbinate, site of posterior epistaxis in adults. That is which vein? That is the Woodruff's plexus. It is the plexus of vein inferior to the posterior end of the inferior turbinate. Reason of epistaxis, that can be divided into three: local, general, and idiopathic. Local trauma, fingernail trauma, injuries of nose. Then there is the intranasal surgery, heart blowing, violent sneeze, infections. There are acute and chronic infection like viral rhinitis, nasal diphtheria, acute sinusitis, and chronic being all crust forming disease, atrophic rhinitis. Foreign body like non-living and a neglected foreign body, rhinolith, and living such as maggots and leeches. So neoplasms are nose and paranasal signs that benign hemangioma, papilloma, malignant being carcinoma or sarcoma. Atmospheric changes like high altitudes, sudden decompression, Caisson's disease, and deviated nasal septum. Nasopharynx means basically adenoiditis, juvenile angiofibroma, and malignant tumors. These three being the nasopharynx. General causes: cardiovascular system, hypertension, arteriosclerosis, mitral stenosis, pregnancy, hypertension, and hormonal disorders of blood and blood vessel like aplastic anemia, leukemia, and this and that. Then K deficiency, vitamin, hereditary hemorrhagic telangiectasis, liver disease such as hepatic cirrhosis, deficiency of factor 2, 7, 9, and 10, kidney disease like chronic nephritis, drugs like excessive use of salicylates and other analgesics, mediastinal compression like tumors of mediastinum, acute general infection, influenza, measles, chickenpox, whooping cough, rheumatic fever, infectious mononucleosis, typhoid, pneumonia, malaria, and dengue fever, vicarious menstruation like epistaxis occur in the time of menstruation. Idiopathic causes not clear. Sites of epistaxis: can you see this is a common and most recurrent site of epistaxis with hereditary hemorrhagic telangiectasis lesion on the nasal septum, tongue, and palate. Can you see? So what is this area? Little's area, 90% of epistaxis bleeding occur from this side. Above the level of middle turbinate, bleeding from the middle turbinate and corresponding area from the septum is often anterior and posterior ethmoidal vessel. And below the level of middle turbinate is from the spinopalatine artery. Next is posterior part of nasal cavity. Blood flows from the directly into the pharynx and diffuse both from septum and lateral nasal wall. This is often seen in general systemic disorders such as blood dyscrasias and nasopharynx. Classification of epistaxis: anterior, posterior. When blood flows from the front of nose in sitting position and posterior epistaxis flows back into the throat, patient may swallow, have coffee colored vomit test, and this may erroneously diagnose hematemesis. That's different. Talking about management, in any case of epistaxis: mode of onset, then is it spontaneous or fingernail trauma, then duration and frequency, amount of blood loss, side of nose from where bleeding is occurring, whether bleeding is of anterior or posterior type, and any known bleeding tendency in the patient or family. So before that and then we also have history of known medical ailment and history of drug intake. Okay, so we'll start with the major treatment measures, but before that we'll just go for difference between anterior and posterior epistaxis. So anterior epistaxis incidence is more common than posterior epistaxis. Site is basically mostly from the Little's area or anterior part of lateral wall, mostly from the posterior superior part of the nasal cavity. Often difficult to localize the bleeding point. Age is mostly occur in children or young adult and basically after 40 years of age, and causes is trauma and cause being spontaneous, usually mild, can be easily controlled from local pressure. Anterior pack, bleeding is severe, hospitalization post nasal pack often required. So talking about first aid is very important because most of the time bleeding occur from little area can be easily controlled by pinching the nose with thumb and index finger for about 5 minutes, and this compress the vessels in the little area. Trotter's method: basically patient is made to sit, lean a little forward with a basin to spit up the blood and breathe quickly from the mouth, and cold compress should be applied to nose to cause a reflex vasoconstriction. Next being cauterization. It is useful in anterior epistaxis and bleeding point has been located and the area is first topically anesthetized and bleeding point cauterized with a bead of silver nitrate or coagulated with the electrocautery. Then we will talk about anterior nasal packing and posterior nasal packing, both of them. So anterior nasal packing: in cases of active anterior epistaxis, nose is cleared of the blood clot by suction and attempt is made to localize the bleeding site. In minor bleeds from the accessible site, cauterization of the bleeding area can be done. If the bleeding is profuse and or the site of bleeding is difficult to localize, anterior packing should be done. For this, use a ribbon gauze soaked with liquid paraffin. About 1 meter gauze, which is 2.5 centimeter in adult and 12 in children, is required for each nasal cavity, and first few centimeters of gauze are folded upon itself and those are inserted along the floor. Then the whole nasal cavity is packed tightly while layering the gauze from floor to the roof and from then before backwards. Packing can also be done in vertical layers from back to the front, and both cavity may need to be packed, and packing can be removed after 24 hours. If bleeding has been stopped, sometimes it has to be kept for 2 to 3 days. In that case, systemic antibiotics should be given to prevent sinus infection and toxic shock syndrome. Now you'll see whether posterior nasal packing like this. So can you see the procedure over here? What happens is, this is anterior nasal packing, right? Can you see? Packing in vertical layers and horizontal layers. That's the posterior nasal packing. Give a pack like this in this method. Can you see? From posteriorly we are packing the nose. That's called the posterior nasal packing. So basically should be hospitalized. Instead of a post nasal pack, Foley catheter size can also be used. Next, talk about endoscopic cauterization. Use a topical usage of basically, okay, there's one question. Postnasal pack is for posterior epistaxis and antinasal pack for anterior epistaxis. So we have what is there is a endoscopic cauterization, that is using topical or general anesthesia. Bleeding point is local with a rigid endoscope and it is then cauterized. It is then cauterized to a malleable and bipolar cautery, and the procedure is basically effective in less morbidity and decreased hospital stay. Elevation of mucoperichondral flap and submucous resection operation, that's one thing. Then ligation of vessel, external carotid, maxillary artery and ethmoidal artery. These vessels can be ligated, like external carotid talking about. So what is there, that so when bleeding is from the external carotid system and the conservative measures have failed, ligation of external carotid artery above the origin of superior thyroid artery should be done. So I'll show you this. So ligation of external carotid artery over here, the external carotid artery is there. Can you see? These over the superior thyroid artery, ligation must be done. And what is there is maxillary artery. Ligation of this artery is done uncontrollable posterior epistaxis. Approach is via Caldwell-Luke approach, and posterior wall of maxillary sinus is removed and the maxillary arterial branches are blocked by applying the clips, and this process is now suspended by superseded by basically transnasal endoscopic SPA ligation. We'll talk about this now. What is TESPAL? That is transnasal endoscopic sphenopalatine artery ligation. So this procedure is done with a rigid endoscope under topical anesthesia with sedation or a general anesthesia. A mucosal flap is lifted in the posterior part of the lateral nasal wall, and SPA is localized as it exits the foramen and closed with a vascular clip. Distal branches of the artery can be additionally cauterized and the flap then reposited, and anterior ethmoidal artery can be ligated with a Lynch incision as an adjunctive procedure. And SPA ligation gives high success in control of refractory posterior bleed. Embolization is done basically in intravascular radiology through femoral artery catheterization. Internal maxillary artery localized, and the embolization is performed with the absorbable gel foam or polyvinyl alcohol or coils. Both ipsilateral and bilateral embolizations may be required for the unilateral epistaxis because of the cross circulation. And embolization is generally safe procedure but may have potential risk like cerebral thromboembolism, hematoma at local site. This ethmoidal artery cannot be embolized. So what is the general measures? Guys, we'll talk about the general measures now in layman terms. So what is there if a patient comes with you complaining of a bleeding from inside of the nose? You'll first, what you'll do, you'll make the patient sit up with the backrest and record any blood loss taking through spitting or vomiting. That's the first step you're gonna do. Second step you're gonna do is basically reassure the patient that you will give a mild sedation should be given. Keep check on the pulse, BP and respiration, that is keep check on his vitals. Then you have to maintain the hemodynamics for you, that you need to give a blood transfusion. Antibiotics must be given to prevent sinusitis, and if the pack is kept beyond 24 hours, and intermittent oxygen may be required in patients with bilateral packs because of the increased pulmonary resistance from the nasopulmonary reflex, and investigate and treat the patient for any underlying local or general cause. Now let's discuss about hereditary hemorrhagic telangiectasia. It occurs in the anterior part of nasal septum and is the cause of recurrent bleeding. It can be treated by using the argon, KTP or NDYG laser, and the procedure may require to be repeated several times in a year as telangiectasia recurs in the surrounding mucosa. Some cases require septorrhomoplasty, where the anterior part of the septal mucosa is excised and replaced by a split skin graft. So guys, yes, now let's start the fun session of this video. This part is about some kind of explanations which need to be very much cleared. Atrial epistaxis is one of the most important topics from otorhinolaryngology, and rest of the videos upcoming will also be important. So stay tuned. Thank you.